A true pelvic tilt cannot be corrected by muscle work or stretches or exercises that involve strengthening muscles or stretching muscles. Same thing goes with unleveling of the hip. If you've been told you have a pelvic tilt, unlevel pelvis, unlevel hip area, unlevel legs, short legs, they cannot be corrected by muscle work, okay? Now, I'm going to explain to you why. I'm going to explain to you how to accurately assess a true pelvic tilt and the consequences it truly has to discs and back pain, leg pain, and other issues. And then a true fix for a true pelvic tilt or unleveling of the legs and how these two are actually connected, okay? So stay with me because I'm going to go through a lot of information. And if I can get access to my chat, then we can actually communicate through chat as well. I'm just seeing my stream over here. If not, I'll catch any comments later on and I'll address any questions you have in the comment section. So let me explain why you cannot correct a true pelvic tilt with muscle work alone. So when we look at the pelvis, okay, so the pelvis is made of two parts, right? Here's one side of the pelvis, here's the other side of the pelvis, and in between, so that's the main pelvic bone, and in between is the sacrum. So the entire pelvis is really three parts: pelvic bone here, and sacrum. Now this is the back side that you're looking at, okay? And the spine sits on it. So the pelvis has direct correlation to the lumbar spine. The lumbar spine has a correlation to the thoracic spine above it, and then eventually the neck. But and then over here underneath are the femur bones, so the top of the femur. So the femur head over here, the femur bone, okay? So the only way for there to be a true pelvic tilt is if one leg is shorter than the other. So you have to imagine that if both legs are level and they're exactly measured equally from top to bottom, so from hip to the bottom of the foot, they're equal length, then there's no way the pelvis can be unlevel, okay? There's no way, right? So they're equal, okay? Which means that the only way that it can truly be unleveled or uneven is if one leg is shorter than the other, then that will cause a pelvic tilt. Now, there could be some sacrum abnormalities affecting the spine, but really, we're looking at the pelvis itself. The only way it can be unlevel is if one leg is shorter than the other. Okay, this is very important, okay, because then you're going to see how we can actually improve and correct this, okay? Now, I don't want to just show you a spine model. So that's from the back side, okay? From the front is like that, but I want to talk about the back side because it's easier to look at everything here, okay? So just imagine if I level it off with the bottom of the screen, okay? So if it's level, but if one is shorter on one side, then the pelvis will be unlevel. No amount of muscle work, exercises, stretching, pulling, stretching will actually get one leg to grow longer, okay, at all, okay, especially as an adult. So that's not going to work, okay? I'm not saying they're not useful. It's not going to work. Now, if you're lying prone or supine, so on your stomach, on your back, on the ground, or on the table, like in a physio office or chiropractic office, and they match up your leg lengths, okay, no problem. Then they may see that one pelvis is off level compared to another. Well, that's going to be a functional misalignment, okay, because muscles are probably pulling one side, and muscle work will help with that. But I'm talking about a true pelvic unleveling, a true pelvic tilt when someone is standing and the effects of gravity are acting on your pelvis and your body, okay? Now, if we look at an anatomical chart, okay? Okay, so grab a pen. Here's a skeleton, okay? So, the backside. If the legs are completely level from pelvis to ground, there's no way the pelvis will be unlevel. There's just no way, okay? You need one leg to be shorter, okay? Now, let me show another poster because I like to do visuals for you, okay? So here's a poster by Chiropractic Biophysics or Ideal Spine, okay? Very simple, okay? So same thing, okay? So if they're equal in length and you're standing, that's going to be level, okay? Now, what happens when they're unlevel? Okay, here's another poster by Ideal Spine or Chiropractic Biophysics. Okay, really good because it shows the only way you can have a pelvic tilt. Okay, so over here, this leg is shorter and the pelvis is tilting. No amount of muscle work will fix that. Or this leg is shorter and there's a pelvic tilt. No amount of muscle work will fix that. Okay, there is something we can do for it, but muscle work will not work. Okay, So that's a true pelvic tilt. And that actually is a rotation on the z-axis. If we look at Cartesian coordinates, it's a rotation on the z-axis, and the only way you can have a lateral bend or a rotation on the z-axis in the pelvis is with an anatomical short leg, okay, a leg length inequality, okay? Now, how do we assess this? We use x-rays in our office to assess our patients. And if I see, when I take a lumbar x-ray, so taking a lumbar x-ray, if I see that one leg is shorter or if the sacrum or pelvis is tilted on one side, I take another special view called the modified Ferguson. I'm not going to go into the details of this, just know that it's a special view and gives me a good analysis of their sacral base and their legs and the femur heads, and then I can make my measurements and see how much pelvic tilting or sacral tilting or leg length deficiency there is, okay? Now, I'll tell you how to fix this in a moment. There's something that's required, okay, that's based on the x-ray analysis that I just talked about. But the consequences of a pelvic tilt, the consequences of a leg length discrepancy, it's going to affect how the sacrum is positioned, okay, the sacrum. And I've seen this in hundreds and hundreds of patients. And the problem with that is that the sacrum is at the base of the spine, okay, the base of the spine. So this is sacrum. This is your L5-S1 disc, L5 bone, S1, so L5-S1 disc. If you had an MRI report and you've had disc injuries, you probably heard that before, and more commonly, L4, L4-L5 disc. So L4 bone, L5 bone, L4-L5 disc. So if the sacrum is shifted to one side, that's going to cause compression of that L4-L5 or L5-S1 disc, and then nerve compression. So I'll go this way, okay? Nerve compression as well, and eventually cause that disc to herniate, bulge, or protrude, cause annular tears, cause local pain and inflammation at that disc level, muscle spasms, nerve compression, not just local back and buttock pain, but also shooting leg pain, sciatica down into the leg and foot, numbness and tingling into the toes, cramping in the legs. If you've been told you have sciatica or radiculopathy or L4-L5 or L5-S1 disc bulge or herniation or protrusion, those are very common symptoms related to that. Not to mention more advanced symptoms like muscle weakness, muscle atrophy, foot drop, and so forth. Okay, so that's some of the consequences that I've seen with my disc bulge patients and disc herniation patients that has very rarely been checked properly in other clinics, whether it's chiropractic, physio, or even medical specialists as well. And also because they're not really well checked and analyzed, they're very unlikely to have proper treatment done. Okay, now I'm not going to go into the details of all the corrective care and chiropractic adjustments and eventually all the targeted work that we do for that kind of a misalignment, but I will tell you that the goal is to level the structural abnormality. Okay, now if one leg is shorter and one leg is longer, we need to improve the side of the short leg. And the purpose is not so much to get the femurs and the legs to be more in balance, but the purpose is really to get the sacrum in balance, because the spine sits on the sacrum and it has direct correlation to the discs, your posture from that point up, and also your joints and ligaments and tendons. So we want to balance that out. So we're not going to do muscle work for this. We're going to do structural correction, and we're going to use a support. And I'll go through a couple examples here, okay? So we're going to use a lift inside the shoe. So I'm going to look at that right there. That's called a heel lift. See, it's where my fingers are. It's a bit thicker, that tapers down. Okay, so and there's different sizes. Okay, so I'll go through all the sizes I have. This is by Real Lifts. There's all kinds of lifts in the market. This is one that I like to use. Okay, so this is a 12mm lift, the max that I'll put inside a shoe. Okay, like that. So it goes in the shoe, and then now I can lift that femur higher to balance out the sacrum and the pelvis. Okay, here's a 8mm, and how do you know which one do you need? Here's a 6. We use that modified Ferguson x-ray to measure this. Okay, here's a 10. Okay, if someone needs more than that, based on the analysis, we can send them off or refer them to a shoe cobbler, and then they can get the shoe built out properly. And I've done that with several of my patients as well. Okay, so what the lift does, let's say in my x-ray analysis, my modified Ferguson analysis, I see that the sacrum is tilted to the left. Actually, I'll be to the right, okay, because I'm looking at the camera the opposite way. So to the right, and the right leg is shorter, right? Then I can put, let's say I measure by 10mm, then I'll apply the 10mm lift inside the patient's shoe, okay? And then in doing so, we'll push them up and get them more level, and then I can re-x-ray them with the lift inside their shoe. It's called a stress x-ray, to see the effects on the sacral balance and the spine. And many times, as long as there's not too much degeneration and arthritic fusions and limitation in motion because of arthritis, degeneration, or chronic problems, we can get that sacrum close to level, okay? So that's what we do to correct a true pelvic tilt due to anatomical short leg that causes a true unleveling of the pelvis or leveling of the hips, okay? So if you've been told you have a short leg, an unlevel pelvis, and you never had a modified Ferguson x-ray checked or a full spine check, I highly recommend it. I'm advanced trained and certified in chiropractic biophysics. And if you haven't met me before, my name is Dr. Walter Sluber. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And welcome to my channel. If you're brand new, subscribe because I do a lot of videos like this that explain a lot of things to many patients. And it gives them a lot of aha moments when it comes to spinal care and preventing surgeries and helping with pain relief through either exercises or, more importantly, in our office with structural corrective care. So if you need a referral to a type of chiropractor that does this kind of work and assessment, let me know in the comments below to get some engagement on my channel and in this video, and I'll refer you to a directory online of other trained and certified chiropractic biophysics doctors like myself that does structural corrective care and these type of analyses, okay? Now, if you have any questions, let me know in the comments below, and be sure to subscribe, and if you found this useful, share, send it to someone that you know complains of short leg, unlevel pelvis, unlevel hips. It could actually make a massive difference for them, okay? And if you want to see more information about how we apply corrective care in stabilizing spine and posture problems, go over here and watch this video right here, and I'll link to you a whole playlist of how we use corrective care, chiropractic biophysics to help people.